right here in the studios, and I come to you yet again with another pertinent one that is about the COVID-19 messages of hope. I have Mr. Tadeo Atuhura. He is the Communications and Partnership Manager at Mildmay, Uganda, and also the Reverend Moses Semagoma is joining us once again. This is his second encounter with us right here on NTV Uganda. He is the Mityana Diocese Health Coordinator and would like to disseminate the COVID-19 messages of hope. Of course, this message comes at a time when we are seeing an exponential increase of COVID-19 cases all over the world. 262 million cases of COVID-19 being registered on the whole global stage. 5.2 million people have died as a result of these infections. The good news pertains to the fact that 236 million have actually recovered. That is the good news. Right here in Uganda, 127,400 plus have gotten infected with this heinous disease, and over 3,252 did not have a chance in the battlefield. They died, they succumbed, they were killed by this heinous disease, COVID-19. How many vaccinations can we actually verifiably boast of? 6.2 million plus vaccinations have been achieved by this jurisdiction, and we need to ramp up more vaccinations, especially in the wake of a new resurgence of a new COVID-19 variant called Omicron from South Africa. We need to ensure that all citizens of this country clamor for these vaccinations so that we ensure that we are well protected. Remember, even in the event that you actually exhaust all your jabs, the 2 doses of those jabs, you need to ensure social distancing and also wearing of the face masks. Remember, you can still get infected and pass on this disease to the next person in your nearest vicinity, infecting him or her. If they are not double jabbed like yourself, they will succumb in that regard. Tadeo Atuhura is joining me and Reverend Moses Semagoma to disseminate the COVID-19 messages of hope. Thank you for joining us. All right, a very good afternoon, I believe. Thank you very much, Tadeo and Moses Semagoma, for joining us. Let me start with you, Tadeo. What are the objectives of the COVID-19 messages of hope? We've been one too many times here conversing about the same issue, but then we could be dealing with some new viewers who are just watching this show for the very first time. Take us through the COVID-19 messages of hope as far as objectives are concerned.
Thank you so much, Romeo, and a great morning, listeners and viewers. The first and foremost, Romeo, special greetings from Mildmay, Uganda, the Center of Excellence for Healthcare, training, research, and changing lives of people through the community approach that we normally use. And as I delve into the objectives of COVID-19, I want to re-echo the message that as a country, as the world, tomorrow we commemorate the World AIDS Day. And it's very fundamental because even COVID-19 as a pandemic is also having issues around how much milestones we have been able to register in terms of fighting the HIV pandemic. We commemorate around the theme, end stigma, end HIV, and also end pandemics. And those are combined together.
Indeed.
So we're calling upon everyone, Romeo, and everyone across the whole world to be able to reflect around that theme. So in terms of the COVID-19 messages of hope, we are back again to remind ourselves in terms of what basically we are focusing on. The COVID-19 messages of hope is really with the support of PEPFAR and CDC and working with the Minister of Health. Mildmay, Uganda was offered an opportunity to work with the faith leaders, to empower the faith leaders, to be able to champion and lead the fight against COVID-19 pandemic. So we work with them to, first of all, reach out to their day-to-day audiences, but also to be able to influence the message that we all have. Observe the standard operating procedures. And you know very well, you've just mentioned it, Romeo, that we're seeing the numbers rising all over the world. We have seen some other countries actually be able to close up to say you cannot come into our country. We've got a new variant. I think you've just hinted on that.
Omicron.
So it's better for us to be able to focus on the standard operating procedures. So in working with the faith leaders, it's to take that message home. Wearing your mask, sanitizing, keeping social distance, even when now we have got 200 people to be able to come to pray. But we need to make sure that we're observing all these SOPs. But also the other fourth thing is for them to be able to be champions and role models in terms of delivering the message on vaccination. As a country, I would like to thank so much the effort by Minister of Health and all the necessary stakeholders. Of course, we're under the leadership of our president, that we are able now to move, I think from the 4.8 the last time we were here, Romeo.
Indeed.
Now we have at
6
least
million.
Yes, 6
Meaning
million.
the people are listening to the message of on COVID-19 and also heading to the coast to go for these vaccinations.
Yes.
That is
And I want to say that I think it's efforts like the COVID-19 messages of hope that have been able to contribute towards this. So we're looking at the vaccination rates also to be able to go out as an input from the faith leaders. So in terms of what we're looking at for the COVID-19 messages of hope, working with the faith leaders, have the influence, fight the stigma around COVID-19, and then also looking at making sure that we are living the talk. Our people are able to believe and trust the message from their faith leaders. And that is in brief about COVID-19 messages of hope.
Tatewat Hura, can we also drum a message of extra caution to be heeded by members of the public that even in the event that you get all your jabs, 1 and 2, you still need to actually ensure social distancing and also mask wearing at all times, because you can still get infected and you can still pass on this disease to the next person. You might not be as affected as this person, but then the other person will die because they never received the vaccine to begin with.
Absolutely. And it's like one of the things that has led to complacency. Whereby somebody says, no, I already got my jab.
I see.
Why should I continue wearing my mask? What about social distancing? I don't have to do all that. I have been vaccinated. I don't have to get to keeping all those SOPs. And we just want to alert the people that no, even if you've been vaccinated, please kindly observe the standard operating procedures. And one of the things that we'd like to emphasize is that even when you're vaccinated and you get COVID-19, the chances are that you are actually not going to move to the severity stage. So what that helps us is, even in management at the hospital, at different facilities, you don't get this surge. So the only way which is scientifically proven is for us to get the jab. Please walk to the next facility where they are actually vaccinating and get your jab.
If you're just joining us this beautiful morning for this conversation, we're talking about the COVID-19 messages of hope in the wake of preparations to fully reopen this economy by January of 2022. Do you want a situation whereby we reopen our schools, we reopen our economy, and 3 months down the road, they are telling us, please go back into a lockdown because there's been a quick resurgence of COVID-19, and yes, the health centers are overwhelmed by this skyrocketing number of patients, and they cannot do away with the meager resources that they do have. We do not want that situation, so please clamor for the vaccinations that are now taking center stage so that you are well protected in the event that there is another wave of COVID-19. In our midst is the Reverend Moses Semogoma. He is Mitiana Diocese Health Coordinator in that regard. He's going to be explaining to us how he has been expediting a few activities to ensure that the people within his jurisdiction near and far actually clamor for these vaccinations. Indeed. A very good morning once again, Moses Semogoma. This is not the first time you've been here, the second encounter indeed. How have you been since we last met?
Oh, I'm fine.
Indeed.
Happy to meet you, Rami.
No health complications, totally fine. You did get your 2 jabs.
Not really.
No reactions up to now.
Actually, if there is another third one, I could get it.
Actually, the third COVID-19 booster is coming, and it's being touted right now in the event of, resurgence of new COVID-19 variants. They're talking about the 3rd booster dose. The Russians are talking about the same. The Americans are talking about the same. They're even giving it to younger ones, 11 to 15 years of age. So it is coming, Semogoma, anytime soon. But between now and since we last met, what kind of activities have you been involved in as far as disseminating this information on COVID and also calling on to members of the public to brave for these COVID-19 vaccinations? What have you been up to?
Thank you so much, Romy.
Indeed.
First and foremost, I want to say thank you so much for this opportunity. Malme Uganda for giving us and also being ready to work with Church of Uganda and faith leaders at large in this fight against COVID-19. Actually, it's better to work with faith leaders because we are the chief shepherds of most communities. And back to our point, since we last met, we have engaged in a number of activities, especially when it comes to observing the SOPs. And now you see me, I'm putting on my mask.
Indeed.
You are not. But I'm safe and you are safe.
Indeed.
The distance is fine.
Indeed.
We have greatly ensured that our communities are sensitized about the importance of the SOPs, where we have the hand washing with soap or using sanitizer if you can, and also ensuring that we avoid crowds, crowded places, because we have seen that people are now taking COVID as a goner case, and now we are saying, no, COVID has come, still here, and we need to fight it together. And what we are doing right now is we're using all church spaces, like the Mothers Union gatherings. We had a very good CMF Day, Christian Men Fellowship, and also we had the Christian Women Fellowship the events, and other events in the diocese, and also congregations where we have Sunday services and also funeral rites. We do a lot of sensitization that COVID is still here with us, and it's our responsibility to fight it as a team. And in that, we are also ensuring that we encourage people to go for vaccination. I told you already last time that I did take my first jab.
Indeed.
I also took my second jab.
Indeed.
And I was happy because I took AstraZeneca, and my wife also did the same. She took Sinovac, and we did it separately to ensure that we emphasize the importance of vaccination and also using all the vaccines that are available on the market, because all vaccines are proven to be effective, and it's our role and our responsibility as Ugandans, as children of God, to ensure that we live a happy and safe life.
All right, that is Reverend Moses Semugama, Mitiana Diocese Health Coordinator, interacting with us right here on NTV Uganda on these COVID-19 messages of hope. Please, dear citizens who are watching this show and right now, do not fear this disease, COVID-19. Yes, we could have been in a position where we could have expressed our fear in 2020 when we had lesser information on this disease, but we are at a moment or in a greater state where we do have a lot of information on COVID-19. Even this new variant, Omicron, it shouldn't be the reason as to why you're having sleepless nights, because we do know and have information or weaponry in our arsenal to actually pull out and fight this disease. What am I talking about? Mask wearing. As simple as that. It is one of the weapons within our arsenal that we could employ to fight this new variant, which is called Omicron, deadly as it is. Social distancing of at least 5 to 3 meters. In that regard, when you are in a hot concentration of 3 to 5 people, ensuring all the adherence of these SOPs will go a long way in actually beating the COVID-19 invasion, even in the resurgence of this new variant, Omicron. Please, fear can only culminate into a resurgence of COVID-19. When people are running amok without any information, people are running to the villages, you're exporting this disease simply because you had of Omicron. You're exporting this disease to the elderly people who might not have the immunity to actually fight back. And also, please do not listen to the misconceptions surrounding these vaccines that they do not offer protection. They do offer protection, even though you still get infected, but you will not be hospitalized and you will not die. You'll just grapple with a little bit of flu as some of the reactions, but you'll be protected against a full invasion of the COVID-19 disease. That's why we are here, to spread the COVID-19 messages of hope, and so that you do not fear in that regard. Tadeo Adhura is still with us, and would like to know what has been achieved as far as engaging the faith leaders is concerned. Reverend Moses Semugoma is also still here, the Mitiana Diocese Health Coordinator. Moses, would like to know what kind of lessons have been experienced in the COVID-19 engagement with these members of the community?
Thank you so much. We have a lot of learning experiences from COVID.
Indeed.
You talked about fear. Many people are scared about the virus. Those families that have been affected directly, those who have lost their dear ones, they have fear. And actually, what we are doing as a church or faith leaders is to encourage them to have hope. Because the end of the rope is not the end of hope. So what we are doing, we are using these people who have been affected by COVID to come and give testimonies in churches. And actually this has helped a lot because they're building hope among the hopeless.
What have you heard? Because one of my viewers might be able to relate with some of the stories you've heard during your sermons in the church. What are some of these victims telling you about COVID-19 and how it's affected their lives?
Some are saying, actually, when you have COVID, you are like a discriminated person in the community.
More like
in the
HIV.
family. More than HIV. Because people fear you. Even your dear one, if you are a wife, your husband fears you. Your children fears you. Nobody wants to come close to you. And this is very dangerous. And it can't be avoided. The only way we can avoid it is observing the SOPs. And secondly, we have learned that economically people have been affected because their businesses have gone down. And actually some people, you find that they cannot even manage to pay for house rent. They cannot take back children to school. And now January is around the corner. The schools are opening. We don't know what will happen because some families will fail to take them to school. And also we find that the increased cases of teenage pregnancy among the communities where we come from are attributed to COVID-19 lockdowns.
I see.
Because we have seen a number of girls turning to be mothers.
Indeed.
And this is very serious.
Over 500,000.
And now we are looking at also the issue of HIV. You know, tomorrow is AIDS Day. We are commemorating AIDS Day. But, you know, some people now are fearing COVID and forgetting HIV.
Indeed.
That's a learning experience that some people tend to fear the virus that comes on the way. But it's my humble request that we need to take COVID and HIV and other epidemics as serious because they all have the same consequences. And we have seen that in our communities back there, in Mitiana, in Muvende, in Chiankwanzi, that stigma is still a very, very big problem. People are stigmatized. Those who got affected or infected are still stigmatized by their fellows. They say, this one is a dead creature. He's still having COVID inside his body. Despite the fact that he recovered, but they are still stigmatizing. They are still pinpointing at that person.
Because of the misinformation they've
Yes,
heard.
because of the misinformation. And actually, the issue of media, I think they will talk about this. But the issue of media, because we have a lot of missing or misleading information on the media.
Especially on
platform.
the internet.
On the internet, non-researched information.
Indeed.
And it's my humble request that whatever we take should come from the health professionals.
Indeed.
Actually, not all health professionals, but we have a source. Minister of Health should direct us. World Health Organization is giving us the right information, so we should consider that information.
What sources are you looking at to get your information? Indeed.
Yes, it's very important because not all of us are researchers. Yeah.
And indeed, I do understand what you mean by misinformation. Tadeo Atuhura. I'm telling you, you know, the whole country and the whole world was rife with these messages. You know, they were touting that COVID-19 vaccines were not actually so effective, that they would cause infertility and so forth. It started as a funny joke. Months down the road, you would see people in the jurisdiction of Mali refusing to go to the vaccination centers. You'd see it happen in Chad. You'd see it happen in Somalia. Neighboring DRC here, people not clamoring for this vaccination simply because someone put up an article and said there is a correlation between vaccines and infertility. Please, right here and right now, spell it out to the viewer that none of these is connected to these vaccines. They are actually very safe.
Yes, and that's absolutely not true. First and foremost, I wouldn't be surprised that people would take it like that. Because Romeo, you and I know, and also everyone knows, this is a new reality.
Indeed.
In terms of the whole thing that kept and swept off everyone. You know, for the first time you're seeing the entire planes are down, you're not moving, the whole world was really experiencing it almost.
The hard way.
Yes. And that creates suspicion, that creates anxiety. People are got to get what really, they want to explain what is it. Now, one of the worst things, and that's why we are really working with the faith leaders, is one, to empower them with the right information. Now, most times when you don't have the right information, it's the beginning source of telling a rumor, it's the beginning source of telling or having all these misconceptions. So, it's not true that actually when you get vaccinated, that you become infertile, or you can't have children, or others. There was also discussion about blood clot. There was whole issues that no, when they vaccinate you, they put a chip in you, they want to track you, they want all those kinds of things.
They're trying to, you know, check the population growth of Africa.
Yes. But we have had immunization and vaccination happen in this country for some time. I was also immunized when I was a child. Here I am, I'm a grown-up man. And I have not had any challenges.
And those who never got vaccination at some point suffered low cognitive abilities in their lifetime.
Yes.
Many challenges
so
as they grew up.
It's not true that actually when you get vaccinated, you're going to have all those things that you're talking about. Now, the quickest experience that we would have for any vaccination, even if it is immunization, by the mere fact that they are going to pierce your body, you feel some pain. Even if it was a stone that I hit, I would feel some pain. So you feel that pain, but that pain is very temporary. But also, before you get vaccinated, there is a counseling session. So there is a health worker who will take you through the process you are going to go through. What are you going to feel? And in case you feel those kinds of things, what do you do next? And our experience has been that even with the faith leaders, whenever we've engaged them, every platform that we've had with them, there is a medical doctor on them who can quickly give information. If you see this, what happens? Because people ask questions. So what clearly happens as far as vaccination is concerned, you get mild actually, cases where you have really, I'm feeling pain, because maybe some others are actually fearing. There are not those that you'd say, I have a clot, I have this. So science has been so clear. And that's why we're emphasizing the issue of vaccination. But I also want to say, there is no any country or no any leadership that would want their people to perish. So it wouldn't be really making sense for us through the ministry to come up and say, no, we are getting this vaccine to kill our people. That's not true. So even our leaders do find out, is this right for us? So indeed it's right for us, and vaccination is good, and it's the only way to go.
Indeed.
Yes.
Indeed, vaccinations do cut hospitalizations by over 90%, but with the resurgence of the new variants, that is Delta, Beta, and Omicron, we've seen that protection window actually reduced to only 60% in that regard. But you'd still be better protected as a double-jabbed individual than someone who was never vaccinated to begin with. You would not actually be, you know, bedridden at some point. You'd actually just grapple with just flu-like symptoms for a day or two, and then you go back to normalcy because your immunity is boosted by the COVID-19 vaccine. But for that individual who never received COVID-19 jab 1 or 2, that person would end up at Mulago. Yes, somewhere on the beds of Mulago in the ICU, grappling and praying for dear life that they are resuscitated in that regard. You do not want to end up as a statistic as part of the 3,252 people who have died as a result of this heinous disease. Now that we have information on it, you shouldn't be a statistic. You shouldn't be part of the 5.2 million people all over the world who succumbed to this heinous disease, COVID-19. Fear and anxiety are the two biggest factors driving crazily the skyrocketing cases of this COVID-19 disease. Now when people hear, oh, there's a new variant, Omicron, they start running amok. They leave one area to another, hoping to seek refuge in the areas that they are going to. But you forget you're living in an urban area where people have some kind of immunity and where people are vaccinated, and you're going to a rural area where there is lesser vaccination taking center stage, and people with lesser immunity to fight back, and they are going to die. And they will not be part of the statistic because there are no health centers, largely, within the rural areas. So the people in the rural areas will just say that person died of witchcraft, and we shall just leave it at that. But then it is COVID-19 and it's killing people. It's just that people do not know what is killing them. Tadeo Adhura is here to make a light on these developments, and also Reverend Moses Semugoma, the Mityana Diocese Health Coordinator in that regard. Let's talk about psychosocial support, Tadeo Adhura, for the victims or former victims of COVID-19. Psychosocial is an important factor in this whole process because of the immense psychological distress that is meted out onto these COVID-19 patients when they are dealing with this disease. Even when they recover, stigmatization, discrimination takes center stage, just like for the HIV patients. Well, what should be done to tackle this issue? Could one of the avenues be the church, spheres as safe havens, whereby Mr. Semogoma can, call onto the congregants to come, maybe on a Saturday, maybe on a Sunday, and offer psychosocial support to the former victims of COVID-19? Can we use churches as safe havens?
Yes. Thank you, Romeo. I think last time we were here, Reverend did point out some illustration here.
Indeed.
When the daughter came to him and wrote a letter.
Yeah.
And said,
when are we going back to school?
When are we going back to school?
Indeed.
So it's real. My children also do ask. Whenever the president is going to talk, they are waiting for when he's opening the schools. And he said, what come May, January is opening up the economy, is opening up the schools. And that raises excitement. The way it happens to me, to Reverend, the same happens across.
Indeed.
Everyone is expecting. So the anxiousness is high. Psychosocial is very fundamental.
Indeed.
And I want to say that one of the things that is a critical objective with the COVID-19 messages of hope is really to deal with the core people. And the core team here are the faith leaders. The faith leaders do give us counseling. Even without COVID-19, they handle so many issues. Whether in celebration...
GBV...
Because I come to my pastor, I come to my priest, I come to my bishop, I come to my sheikh when I know that I am exposing my pain to God. So he's a man of God. Rarely, everyone will say in the layman's language, these are men of God.
Indeed.
These are people of God.
They're here to listen.
Yes. So they listen to a lot of things. They counsel us. They nurture us. They walk us through so many pains. And that's why it is very pivotal for us that whenever they are engaging, whenever they come with this audience, and remember, they have got an audience every day, every time. They have somebody who is calling them. Reverend, I have got this problem. Reverend, I have got this issue. My daughter is this. My son is this. And then go through the necessary counseling. Now, one of the ways to reach out is to ensure that the faith leaders are able to counsel. But they must counsel with the right information. And that's why we empower them. Because if you call me and say, look, Reverend, I'm not feeling fine. I'm having the following symptoms. It's very quick for everyone to say, okay, have you tried to get to test for COVID-19, for instance?
Were you vaccinated to be?
Yes, were you vaccinated? So engaging in that discussion is very fundamental to lead to psychosocial services. But also when I have healed and I've gotten back to church, what is the atmosphere to welcome me? Do they celebrate me? And under the COVID-19 messages of hope, we have celebration as very fundamental. And Reverend, I think even across the other team members, they have had an engagement through testimonials, where somebody comes and tells the testimony of what he or she went through, how she was able to survive, and how best the rest can be able to learn from him or her. And welcoming everyone, and they celebrate together, because life is given by God. God gives us the responsibility to keep this life. But also it's very important that one of the ingredients of human beings of staying together is love. So you love your neighbor as you love yourself. So one of the things is that, who is your neighbor? Even the person who was healed of COVID-19 is your neighbor. So you need to make sure that you are loving them. And if people are not stigmatized, they are going not to come out even when they feel that, I think I have symptoms of COVID-19. So they don't have to hide back. We have seen it. So
just like HIV,
yes.
if we continue discriminating, stigmatizing these individuals over, this COVID-19 disease, others who might fall prey and get infected might refuse to come out.
Yes.
Because of how we treated the person that was next to them.
Yes.
I see.
Yes, and you just picked it from me, Romeo. It's a great experience that Malmö, Uganda has had as far as fighting HIV pandemic. Stigma is one of the most critical issues that affects adherence.
Especially for the men.
Yes, because once somebody is stigmatized, they tend to withdraw and they tend to completely say, I cannot participate in anything that's available for me. And that's the biggest point. I don't want them to know. Yes, and that's why we're emphasizing the issue of hope. A person who doesn't have hope really is a very difficult person to deal with.
And of course, when it comes to the COVID-19 disease and the fight against it, we can only fight something that we know where it resides.
True.
If people are not actually divulging information that I do have COVID-19, how else will we know that this is where we need to vest our hopes and energies to combat the same?
Yes.
Go ahead.
So it's because of that, working with the faith leaders,
Indeed.
and I'm so excited to say that the team has done a great job.
Indeed.
Because they continue to engage, even where we're not. When you look at the turn up of people who are coming up to say, no, I want to get vaccinated, reason being, I was actually alerted or told by my reverend to get to be vaccinated. And there's so many issues that are related to COVID-19, Romeo. One of it that quickly comes onto the table is the issues that are coming from the economy. The economy has affected people differently. So even at home, even where you need to have a stronger psychosocial system to be able to destabilize the family structure, to be able to stabilize harmony, to make sure that people are really staying together and they're able to live together happily. And the only way to do that, you need to touch onto the spirituality.
Indeed.
Because beyond that, when somebody says, I don't fear God, give them gap, give them some space. Because then where do you hinge your faith? Because it's that faith that you build and say, tomorrow is another day. COVID-19 is here, but it will go. We have seen so many things that have come and have gone. Today, my children cannot go to school. They can study from home. But when the term opens, when the economy opens, my children can go to school.
Indeed.
Now, that's hope. I have left this business. I can start another. And I must emphasize this, Romeo. It's only people who are healthy, who are alive, that can work.
Indeed.
That can create impact, that can praise God. So the bottom line is...
Even for education.
Yes, we need to have people vaccinated. We need to have people following the standard operating procedures. So even at church, even at the mosque, the other day we were here with Sheikh.
Ramadan.
Yes, it's about following the strict adherence to these SOPs.
Very insightful conversation I'm having with Tadeo Atuhura. He is the Communications and Partnership Manager at Maldme, Uganda. This is more of a serious kind of activity that we've been holding, courtesy of Maldme, Uganda, advancing the COVID-19 messages of hope. He is not alone in studio. We are also joined by Reverend Moses Semugoma, hailing all the way from Mityana Diocese. He is the health coordinator for that jurisdiction. Gentlemen, thank you very much for staying with us right here on NTV Uganda. We shall go for a short break and return briefly with more messages of hope as far as COVID-19 is concerned. Domo Vamaso. Information about this heinous disease COVID-19, but you and I know if I social distance, if I keep 3 to 5 meters between me and the next person, there is no way I'm going to inhale those COVID-19 pathogens. If I'm always sanitizing after touching these very dirty areas, and I'm sanitizing all the time, the COVID-19 pathogens stay on the palm, and I'll kill them when I sanitize. That is information. When I keep the mask on, it is giving me protection up to 80%. I cannot inhale those COVID-19 pathogens. Why 80%? That is the window the masks give you. The 20% protection will come from the social distance that you're putting through between you and the next person. Does that make sense? A face mask is going to give you 80% protection. The 20% to make 100 is going to come when you social distance between you and the next person. That is how you'll be assured of the 100% protection. Meaning, even though you're wearing that face mask, but you're not ensuring social distance between you and the next person who is coughing, yes, you're going to be inhaling some of those COVID-19 pathogens, and then you'll be adversely impacted all the same. We're also saying, please go and clamor for these vaccinations that are now taking center stage. We're now kept at 6.2 million vaccinations, and we need to ramp up more, up to 22 million vaccinations in that regard. That's why we are here with the COVID-19 messages of hope with Tadeo Atuhura, the Communications and Partnership Manager at Maldme, Uganda. We also have a clergy faithful within our midst, and that is Reverend Moses Semugoma. Semugoma hails from the Mityana Diocese as the health coordinator for the same. Very good morning once again, Mr. Tadeo and also Moses Semugoma.
Thank you.
Indeed, before we went for our break, I was tasking Atuhura to help us understand why it would be so significant to have psychosocial support centers among the churches or places of worship. And in your opinion, as someone who is always in the church spheres, interacting with the congregants, how important would it be to put in place psychosocial support centers within the church spheres, putting in mind that the doctors right now are too stressed? They're thinking about one thing. When am I getting my allowance? When am I getting my risk allowance? So the last thing on their mind is actually dealing with psychosocial support of those who have already recovered. They will deal with those who are in the ICU. But now it's those in the ICU and their salaries, including risk allowances. So that's where you come in, offering psychosocial support. How would you navigate that?
Thank you so much, Romeo. In situations actually where we have such pandemics, we need a lot of counseling, and the faith leaders play a very pivotal role in that area.
Indeed, Reverend.
Because on Sunday, I'm giving an example. On Sunday, we had a very good event where one was celebrating after recovering from this virus.
Indeed.
This is a lady from Chiboga. She was happily testifying that she had lost hope. But the only way she gained hope when she was in Mulago, it's when she could only see, hear people talking about God, talking about Jesus, talking about the love, the love that Jesus and God has for her.
And how he has rescued them.
Actually, without social support, we have cases where people are mentally going to run mad. The insanity is going to increase.
Mental disorders.
Mental disorders. And this is serious and we need to address it. And as a church, as faith leaders, what we have been doing actually, Tadeo talked about getting the right information. Because during these psychosocial support counseling sessions, we need also to have the right information to pass on to these people. And actually, this is what Maudme is doing with the faith leaders.
Indeed.
They have produced good materials for us to use during counseling sessions. And we are using this. And also, we have a platform, WhatsApp group, where we share the information to be shared to these people. And actually, what we are doing now, during the psychosocial support, we are extending God's love to these people. We are celebrating with them. Because getting infected or losing someone because of COVID is not the end.
And it's not a crime punishable by the
crime.
community.
We saw what happened when HIV had just started.
Isolation.
People were isolated, people were discriminated, people were whatever they said of these who sinned. And now we are saying COVID has come, but we need to create situations where we have love for one another. Because
when we isolate these individuals, it can actually lead to suicides. This year alone, we are talking about nearly 1 million suicides this year alone.
Now, the only way we can curb that is to coming close to these people.
Indeed.
And what we are doing in a church, we have sessions for these people. Actually, not only those who have been infected, but also those families that have been affected in one way or the other, because we are talking about the effect of COVID. The post-effects are many. The social support comes in because we have seen in Mityana, in Zigoti, we saw a very young boy, a very young, a very young woman who committed suicide. Committed suicide because of this. This is serious.
So COVID did not kill her, it was because of the immense shame, discrimination and stigma.
She couldn't have friends, and the only way she saw is to
end it.
So we are saying that let's have compassion. Jesus is the source of compassion. He was compassionate. Those who sinned, those who had challenges, he could bring them back. So it is our role as faith leaders to bring back these people who have lost hope. I've already told you that those who have lost hope shouldn't stop there. They should gain hope. And the only way we can do it is bringing them, making them productive. We have seen areas where they have been stopped from associating with other friends because they say you are no longer part of us, and this is where we come in, because we cannot allow such to happen, because if it happens, then the love of God is not exercised. And also we need to look at this issue of giving them support, like if you have what to eat, and for them they don't have to eat, something to eat. If you have, you provide, because this is our responsibility as citizens.
Because as we battle COVID-19, hunger is also killing people.
Hunger is
Could you
also
imagine,
killing.
Reverend, every day 30,000 people are dying because they have no access to food?
That's a very big number. So, and when you look at that issue critically, they are all related to issues where people are not concerned about one another. They are tending to live in isolations. They say, for me, since I have food, since I have money, since I have whatever I need, I don't need to know what is happening to my neighbor's house. And actually, this is where we say we need to create an environment where we are all equal. You saw what happened to COVID when it has just stuck. It equalized everyone, the rich and the poor, the urban and the rural. Were all, nobody could fly, nobody could move, nobody could what. So it means it calls us to love one another, to be responsible to one another, to be one brother's keeper in our communities. And also, we have in Hosea 4:6, it says, my people are destroyed for lack of knowledge. People need to get knowledge, the right information, so that they are able also to pass it on to other people. And what is it that we are doing? We are trying to create an environment where we have religious leaders trained, equipped to go and also do psycho-social support amidst these families. Because many people actually are still struggling. The battle is not yet over. The battle is still struggling. I mean, continuing. And Professor Maswa once said that health is made at home and repaired in a hospital. He talked about the doctors being stressed. Actually, they will continue to be stressed if we don't do our part. The only way we can do our part is observing the SOPs. And if we do that, then we leave the rest to the doctors.
They will have fewer patients to do.
Yes, because there are fewer the patients, then definitely the workload will be reduced. And if the workload is reduced, the doctors will also rejuvenate and do their own other, because they are not going to attend to only COVID patients. They have other patients to look at. So we need to look at that. Also, the economy of the country. The economy of the country. And if the economy of the country goes down, definitely the home economy also goes down. The church economy goes down. So it is one way or the other that we need to work together to build psychosocial support, to bring messages of hope to our congregation, to our people we live with in our communities.
Of course, Tadewa Tuhura, Reverend Moses Semugoma says that knowledge is power, but then the biggest population that needs to hear this knowledge are in the rural settings, and largely in the far-flung areas, they're not getting this information. What is Mild May Uganda doing to ensure that you reach out to the people within the rural settings? You do know how poverty levels are actually biting within the rural settings. Someone would actually say, my battle is not against the COVID-19 pandemic. My battle is against poverty. How do you tell such an individual to actually exercise standard operating procedures? How do you tell that individual to actually adhere to the mask wearing when all they need is food on the table? That also brings in another aspect. Tadeo.
Yes. Now, under the program, under COVID-19 Messages of Hope, that we are implementing in several districts where we are currently working with the accelerating epidemic control, that's for HIV. Before COVID-19 came in, we're just integrating this component of COVID-19 Messages of Hope
into your HIV structure.
Yes. So, and our structures are really up to the grassroots.
I see.
Reverend knows that we've been to his office several times. We've worked together several times in making sure that we're creating impact at household level.
Indeed.
Our care our care approach is looking at the family-centered approach to care. We do not only wait for the person to come at the facility. When you present yourself at the facility, we also want to get to know the other elements on where you stay and how they actually are able to impact onto your health care, but also even seeking for health care at the same. So in terms of how we reach out to the grassroots, we work through the community structures, we work through the village health team structures, we work through the community leaders, work through with the faith leaders as well, and that's why it is very easy for Maldme to integrate all these components within our already existing structures. So, and why that is important, Reverend has come from Mitiana, and Reverend every day, I don't know how many services that Reverend has in a month, or how many people he meets. So it's through such a kind of strategic approaches of engaging the faith leaders in these rural areas. Is Mitiana rural? Yes. Mitiana is rural. It may look to be a few hours from Kampala, but still rural. And it's one of our districts where we implement activities. So Reverend on a day-to-day basis is talking to fellow community members. And that's one of the approaches. But also the other is, we also use media. And here media is, we're looking at all across media, including radios that are within the communities. A case in point, we have the programs in Mitiana that are being run on radio. We have programs in Mubende that are being run on radio. We have them in Nakaseke, Seke FM. So they are running programs to ensure that where Reverend cannot reach, then they can be able to reach with the rightful message. But also the other aspect that Reverend talked about is empowering him and the entire leadership to be able to have information that they can pass on. Because one of the things is that it is very important for people to come to you and ask for information. It's rather much more valuable for you to have the information and the right information. Because no leader wants to be found with gaps as far as information is concerned. So we make sure that they have the right information. They have got the brochures, they have got the WhatsApp platform, they have got that we continuously are able to empower them.
Well, of course, if you want to know how well-informed a society is, you need to take a look at its leaders. If the leaders are not informed, just know even the society is not informed in that regard.
Exactly.
Well, he did mention something that was critical. During his congregation, there were some people who needed psychosocial support. They were talking about how they did not have food on the table. And Semugoma talks about sharing of food in the event that someone is actually distressed. And that's why we're talking about uplifting economic livelihoods of the citizens in this country as one of the models to beat this pandemic and also ramp up vaccinations. Why? Because if someone is on an empty stomach, the only clamor that they have is for food. This person would be actually in a worse position if they were told, please walk and go to Health Center 3 for this COVID-19 vaccination. They'd be like, but I haven't eaten. I have nothing in my stomach. My children at home have nothing. So do you think or believe, Tadewa Tuhura, that we would be in a much better position to beat this pandemic and ramp up vaccinations if we played hand in hand or in tandem with increasing the economic livelihoods of these households in the country?
Yes, that's true. And that's why I really give all the credit to government.
Indeed.
Because one of the sectors actually that was not affected that much with COVID-19, that continuously worked, was agriculture.
Indeed.
So farming continued. People continued doing their cultivation and making sure that there is food. And I think one of the things that helped us as a country is to make sure to have people still having their food back at home. The bigger challenge that we still have, and we still encourage people, even before COVID-19 came on board, there was a lot of reluctance as well. Your Reverend will tell you there are those who prefer to stay in the trading centers and discuss and converse and what, but there are those that prefer to go and work and ensure that there is food on the table. So it is really right that people are able to have something to eat, but also in health as well. If somebody is eating well, even when your
the immunity is boosted.
Yes, the immunity is boosted, but also stability in the home. Whenever there is food, I think we thank God that in Uganda there is plenty of food. You can have some isolated cases of people not having what to eat, but at least we know that we have got the food available. At one point, of course, government tried to distribute food, But also the bigger part was, can our people continue working and ensuring they have what to eat? But also what is most important is that, Romeo, you cannot go to a garden if you're sick.
Indeed, you can't.
You cannot go to do anything if you're not feeling well, if you're unwell. And one of the critical elements is, if you are healthy, if you take the necessary precautions, like I said, it is the one who is alive that is able to work. So the most focused point is for people to be able to preserve and keep their healthy up there, because that then helps them to go and do whatever they have to go to do.
All right. Reverend Moses Semogoma, of course, we talked about fear and anxiety driving up the cases of COVID-19 resurgence within Uganda and also other jurisdictions within Africa. So meaning, even if we are to reopen churches every Sunday, not all congregants will be able to come simply because of that fear among members of the public. Oh, I'll go to this church. I'm going to, get infected with COVID-19 because I'm going to be among 200 people, some of whom might not be wearing masks. It's, even though they are wearing them at all times, one will just put it down and cough at some point, and then there will be a resurgence. So there's that fear and coming up with excuses not to go to the churches or places of worship. Have you explored these other idea of actually leaving the churches and then going for these patients or for these former victims or survivors of COVID-19 in their confines or their humble abodes to actually attack them with this conversation or idea, message of COVID-19 messages of hope?
Thank you so much, Romeo. Actually, you're bringing the right direction of what we are doing in the Mityana.
Indeed.
And before I talk about Mityana, Romy said Mityana is urban area. I mean, Tadeo said Mityana is urban area.
Yeah.
But Mityana diocese covers even Chankwanzi,
even
Chiboga, Kasanda, Mubende. So it's quite a big district.
I see.
Diocese, and it's part of rural and urban. And when it comes to issues of Christians coming to church because of fear and what, we are very much aware of that. And actually what we are doing right now, we have home visits, pastoral visits in their homes, because we need to reach them. Those who cannot come, and actually their families, where we have the elderly, they who cannot come, we go to them. Those who are affected, they are psychologically tortured, we go to them in their homes. And actually we are having services, we are having pastoral visits to them, we are having counseling at their homesteads, not only at church level, but also to the homestead level. And this is actually helping us a lot, that we come close to them. They know us better because the good shepherd goes to the sheep. He goes to them, he sees where they graze from. And if he does so, then he's ready to understand their problems. He's also ready to support them.
Go ahead.
And you talked about migration, movements, people migrating.
From the urban to the rural.
From urban to rural. And now we are in the Christmas mood, where people are going to begin moving. A lot of jam is going to be in Kampala, almost all roads getting out of Kampala. And this is a serious warning. We need to minimize our movements.
Indeed.
Because
stay put.
We need also to observe the SOPs as we go to these communities in our rural areas. We need to understand that the virus is still there, the virus is still killing, and the only way we can do it is to minimize movements. It's better you stay in one place, because if we don't minimize, the chances are there that the virus could again rise.
Indeed. Reverend Moses Semogoma, Tadeo Atuhura, let's use the last 2 minutes that we have in our midst actually exhaust your last pointers. Speak to the people who are watching this show right now and give them a COVID-19 message of hope in the run-up to the full reopening in January of 2022. What should they know about this disease? Where should they go for these vaccinations? And how prepared should they be?
Thank you, Romeo. The viewers, in terms of vaccination, government has been able to put vaccines across all the health centers in the districts. Please, wherever you hear that they are vaccinating, go there. At Malme Uganda Hospital, our general hospital, we are vaccinating, and vaccination is free. I must emphasize, vaccination for COVID-19 is free. We receive our vaccines from Wakiso district, thank you to the team there. And currently we're vaccinating using Pfizer. We have Pfizer, so please come to Malme and get vaccinated.
Indeed.
And in relation to that, also making sure that we have got good health care, we, from the 9th up to 11th of December, we're having a gynae camp, what they call a gynecology camp. So we will be focusing on the reproductive health services to our people, more especially the women. So you can come at Malme Hospital, they will vaccinate you, they will also test you.
And indeed, I will be there and would like to call on members of the public to listen and heed to that call and show up for those vaccinations. My name is Romeo Busiku. Special thanks to Tadeo Aduhura, the Communications and Partnership Manager at Malme, Uganda, and also Reverend Moses Semogoma, the Michiano Diocese Health Coordinator in that regard. Please go and clamor for the vaccination.